Hello, and welcome to the GE Centricity Electronic Health Record Documentation Training for the Massage Therapy Department. In this training, I will go through the forms needed for the initial evaluation and/or a new client. This training is intended to be shorter due to the options that we have with form names. Each encounter is an initial evaluation, a daily visit, or a follow-up progress report. The only part that changes is the subjective section. Every other form that loads based on the encounter remains the same. So therefore, it is highly recommended to review the daily visit video that we previously recorded. And this video will only contain the two forms different in initial evaluation and highlight the different paper forms that will be developed once the client checks in. As you will see on your schedule, we have Mickey Mouse checked in. On Mickey Mouse A, however, you will see massage is new. When you hover over the massage, a pop-up will appear highlighting the details of that session. Within there, you will see a new student massage is scheduled. Sorry, it keeps dropping away on me. But if you hover over a different patient or client, it will change the information that was developed during the schedule. So you will want to open the patient's chart from the schedule. Select a new document. Indicate the type of encounter type. Empty initial evaluation. Make sure the provider is the supervisor or billable provider selected, and the correct information is here, and for the production environment, it is associated to the existing appointment as indicated here, and click OK. From here, all of the forms will load, and the only difference between this and the daily visit is the first two forms. The Massage Therapy Health History, or HH, / Massage Therapy Contraindications or Considerations for the session is found at the very first visit. I would highly recommend as a new patient for you to open their chart and click on the first form when you load in initial evaluation. X out of your RDS cluster so you are not violating HIPAA. And when you walk back into the patient's room or the provider's room, you would open your RDS cluster and log in and indicate the things that they have on their intake form right away here. If you're not comfortable following this list, you can select the provider notes and type what you have found on the intake forms in this box and go back and edit it into this box. So here you will see medical information. Client presents with the following health history. Accidents or traumas, you can indicate a date. You can also say if they have any injuries or impairments, whether they deny it's unknown or you did not ask the question. Here you can select surgeries. Medical illness or hospitalizations, medical or health conditions, medications. If there is anything that's pertinent to massage therapy, such as pain medications, and so on, you would want to indicate it here. Any allergies or any other information related to their medical information, you would populate in these boxes. Once you have selected those information, it will have a subheader in the text translation and each thing you have indicated in the text box listed below it. This section is very easily referenced when you go back to look at a patient's note and highlight their medical information. The second part of the form is contraindications or considerations. You would want to note anything that is pertinent to the massage session and whether they are appropriate or not appropriate for a massage. This was intended to actually be a radio button. So if they are appropriate massage and there's no considerations or modifications present, you would check here. If they're appropriate for massage and they have contraindications or modifications based on the elements of massage, you can select it here. If they can't lay prone, if they have certain suggestions, no feet. This is also sort of like a preference session, so it was supposed to be developed to have a lot of variation or options. Remember, each indication here, you do not have to indicate something. Only select the things that are relevant to your session. And it will preload here. The next form is experiences and preferences. This form is whether the client is new and it's their first massage, or they're new and their last massage was a certain type of treatment. If they only had a chair massage in the past, or it was in Hawaii. I'm just using an example because it is very cold right now. Client states the last massage treatment was within the last week, month, 3 months, 6 months, year, unknown. And the frequency, or what they felt. If it addressed the goals, did not address the goals, no change, some change, sore afterward, notably better, or very relaxed. If you have other options that are not selected there, you can indicate that in the provider notes. The next section is preferences for the session. This form is where you would indicate any preferences, whether there is none, they request to start face down, face up, the lighting, heat, lubricants, music, noise, pressure, bolstering, and so on. And also you can select areas to not be addressed, such as feet. And once you have indicated the past massage experiences, preferences for the session, medical information, and any contraindications or considerations, you can continue on to the exact same forms that you would use in a daily visit. The last part to remember is the paper forms. When a patient checks in, they will have their intake forms, their HIPAA form, their informed consent and Bill of Rights, and outcome measures used. The intake forms are copied into the health history EHR form. The HIPAA is signed by the patient and reviewed during the intake. The informed consent and Bill of Rights is signed by the supervisor or billable provider and the patient before the massage begins. And lastly, the outcome measures. This is entered by the front desk and routed to the provider for review and signature. The front desk will use the outcome measure and select the score, and for massage therapy we use the pain score form, and for this day there were a 7. From here they end and route it to the provider that they are seeing for that day. Once they place it on hold, it will end up in the patient's chart at the top. When the provider logs in, they will see an edit field and also the top part of their desktop, they will see how many documents are unsigned. This will include the outcome measures that were routed to you. Going back to finishing up the form, once you have used all the other forms that you'd use in a daily visit, the intern will, select .I sign and do the intern signature. Select end and route it to yourself if you are not done, or route it to the provider listed in this box here that would be automatically loaded in the production environment, and click hold. This concludes the electronic health record initial evaluation training. Thank you for your time.